Given your expertise as Deputy Director of the Massachusetts Health Connector, which the ACA was based on, I'm curious what you see as the major shortcomings of the ACA.
Well, one of the ACA's biggest shortcomings was not by design, and that's the one that I spent the time on with the slides, just to show that this choice of Medicaid expansion is having really significant and harmful impacts, and that was, again, not how it was designed, but it's where we are, and it's something we absolutely have to pay attention to, because it's having disparate impact racially as well. When you think about who's uninsured in the South, it's disproportionately African Americans, people of color, and so along with being disenfranchised and still in so many ways today, they're also going to be suffering tremendous harmful health effects by not closing this gap. So that was a very unfortunate thing, which I think is something that a new administration could try to address, certainly by putting some more funding on the table for states who would like to opt into closing that gap. So that's a shortcoming. Also, the ACA, frankly, yes, it had subsidies on the sliding scale, but the subsidies aren't as generous as what we did in Massachusetts. So they're not as robust. And that is unfortunate. And it's something that the Biden-Harris platform is seeking to address, to basically amp up the amount of those subsidies. And that would truly make the coverage more affordable. It also, well, I'll leave. There was also the stick parts. The carrots are the subsidies, and the stick is the requirement to have some form of health insurance, and that's trying to make sure that healthy people buy in, even if they don't think they need it, and that helps keep all insurance costs lower because the risk pool has more healthy people in it. That the jury's out a little bit as to the efficacy of that mandate. We've had it in Massachusetts ever since 2006, and there's studies that show it's very effective. It's become extreme political issue at the national level, and it's something that the Republicans zeroed out. And so we're now running the ACA without it. And so we'll have to see whether that really mattered in terms of the risk pools. What the ACA was unable to do was really tackle the high costs that underlie our healthcare system, and why we're spending twice as much as other developed countries to get less results. A lot of it is about our prices being higher, and it did not go after changing the fundamental pricing structure. It allowed for a lot of experimentation through the Center for Innovation, but it didn't require things. And so there's a lot more that could be done there to help lower system costs, or at least keep them from growing so much, in order to keep the whole enterprise more affordable.